where you have a problem with ventilators. We're working very hard trying to find. Nobody in their wildest dreams would have ever thought that we need tens of thousands of ventilators. This is something that's very unique to what happened.
Nobody would have ever thought in their wildest dreams we need tens of thousands of ventilators. That was the president today, yet again lying. The idea that no one anticipated a shortage of ventilators is ridiculous. Many people saw precisely this eventuality. And not just 2 months ago at the beginning of this outbreak. No, scarcity of life-saving medical supplies during a pandemic is something people have been writing about for years. In fact, get this. Donald Trump's own Department of Health and Human Services ran a simulation scenario involving a pandemic that began in China, codenamed Crimson Contagion, during a series of exercises that ran from last January to August. And the folks in HHS in that study foresaw the needs that we're experiencing right now. Domestic supplies of on-hand stock of antiviral medications, needles, syringes, N95 respirators, ventilators, and other ancillary medical supplies are limited and difficult to restock because they are often manufactured overseas. That's in a report of that exercise from HHS last year in his own government. U.S. hospitals have roughly 160,000 ventilators, and just like the Trump administration study predicted, that figure is far short of the 740,000 it would need in a severe pandemic. So the question is, in a worst-case scenario, where are the ventilators going to come from? For answers, let's turn to Sarah Kliff, an investigative and health policy reporter for the New York Times, who co-authored a piece out now titled, "There Aren't Enough Ventilators to Cope with the Coronavirus." Sarah, what is the mismatch right now in terms of what we have and what we need?
So the mismatch is not necessarily with what we have right now, but what doctors expect is coming. They expect that they're going to see a lot of patients in respiratory failure, and they're going to need to put them on ventilators. And we might be, 2 or 3, 4 times short of the number we actually need. As you mentioned, Chris, there's about 160,000 in American hospitals, another 12,700 in a national emergency stockpile. But we might need more like 600,000-700,000 to treat all the patients who are coming in. And right now, for that story, I talked to a lot of hospitals, a lot of ventilator makers. The story that we're hearing is hospitals are trying to buy these machines. They can't find anyone to sell them. And ventilator makers are trying to ramp up demand, but they can't increase it fast enough to meet the needs that hospitals think they're going to have in the coming weeks and months.
So is that on the supply constraint side, right? So there are some domestic manufacturers, though much of it manufactured in China. What do they say about how much they can scale? Is it they don't have the ability to do it?
Yeah, so some of it is about supply chain. A ventilator is made up of hundreds of parts, and those parts come from all across the world. And right now, ventilator makers are all scrambling to get the same parts. So there's a supply chain issue. There's also a workforce issue. One of the things that's really challenging right now is these ventilator companies want to bring more people into their factories at a moment when we are trying to prevent large groups of people in being in the same place. So it's expensive. You have to buy protective equipment, which we know is also in a shortage.
Of course.
You have to increase your janitorial staff and you have to convince your workers that are new to your company, you should come do this work at a time when you're being told, maybe it's best to stay home. So there's all these different issues that make it difficult. Ventilator makers are trying to increase their capacity right now, but there's a lot of things that are working against them when we're kind of in a moment of crisis.
There was a headline earlier this week out of Britain that said that it had asked manufacturers, including Ford, Honda, and Rolls-Royce, to help make health equipment, including ventilators. The invocation of that Defense Production Act. How feasible would retrofitting other factories into ventilator manufacturing be, or is that a fantasy?
I think we might find out in the coming weeks whether that's actually reality or fantasy. You see something here in the United States where President Trump has talked about using a Korean War era law to do something similar. Mary Barra from Ford was saying earlier today that she would give over her manufacturing lines potentially. So we might see it, but the ventilator makers that we spoke with for that article, they said it was going to be pretty complex. Again, these ventilators are very specialized machines. It's going to be really challenging to change a car making manufacturing line to a ventilator making manufacturing line and train the people to do it right. So it might work, but we just don't know. We'll probably find out in the next few weeks if this is a feasible approach or not.
I've been hearing a lot from ER docs and ICU docs who are really worried about this. In the Into the Breach, there's this incredible video that's circulating from Dr. Charlene Babcock, who's an ER doctor in Detroit, who actually published a piece about how to hack your ventilator for one patient into being able to use it for 4 patients by basically kind of like putting more tubes into it. And I saw another tweet today from a rural hospital that had actually done a similar operation. How much do you anticipate we're going to be seeing doctors attemptly try to pull this off?
I think we're going to be seeing a lot of makeshift things like that. Things I heard about in my reporting were possibly, for example, using veterinary respirators for humans. These are not things that happen in normal circumstances, but if you're in a case where you have no other supplies, they might be the only way to help people. One other thing you might see is there are anesthesia machines that are usually used during surgery. If surgeries get canceled, as we are seeing elective procedures get ended, those might be used, those could be kind of retrofitted as a ventilator in emergency situation. So I think you're going to see a lot of sharing among emergency room doctors about what works, what doesn't. But again, none of this is kind of the status quo. All of this is going to be a little bit ad hoc. And I think that's what makes a lot of providers nervous, is that they've never really done this before, and they're using machines in ways, that are completely new to them.
Yeah, that is worrisome. Sarah Kliff, thanks so much for making time tonight.